SRM Institute of Science and Technology, Engineering, Medical and Health Sciences, Management, Dental, Science and Humanities, Law, Agriculture Sciences, Hotel Management. Admissions open.
When you live in a fast-moving, ever-changing world, life brings forth unlimited possibilities. Yours to explore, excite, enjoy, educate, evaluate, and elucidate with Elan. Never stop moving forward with Darwin Platform Group. Darwin Platform Group, the visionaries.
ThyroCare, the trust, the truth.
Our next keynote address is on managing mental stress and anxiety at the workplace. As billions of people have been cooped up at home for over 9 months, it has led to all kinds of stress issues. One of the less spoken about issues that has come to the forefront during the pandemic relates to mental health. With jobs at stake, incomes falling, and greater pressure on running homes, stress levels have risen. It is to address this less talked about subject that we have Mr. Vikram Patel, Professor of Global Health at Harvard Medical School.
For the last 25 years, I have worked in India especially, but also in many other countries of the world, trying to figure out ways in which we can promote mental health, prevent mental health conditions, and enable people with mental health problems recover in a variety of settings. Today, I'm going to be speaking to you about what we know that we can and should be doing in the workplace. Firstly, let me just clarify what I mean by mental health. For many of you, when you first hear the words mental health, you will be thinking about mental illness, madness, sickness, medicines, and doctors. But as you can see from this definition put forward by the World Health Organization, mental health is much more than that. It is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of everyday life, can work productively and fruitfully, and is able to make a meaningful, purposeful contribution to his or her own community. This is a much broader, a much more encompassing definition than what we have historically often conflated mental health to be. Mental health incorporates a range of human experiences: what we're thinking, what we're feeling and experiencing and perceiving through our sensory organs, how we behave with one another, and a variety of higher executive functions such as memory, mental flexibility, and self-control. Mental health is far more than mental illness or even just the absence of mental illness. Now, why is mental health in the workplace important? Well, for a variety of reasons. First of all, mental health problems are extremely common. The National Mental Health Survey of India, for example, reported that roughly about 10% of all adults in India were suffering from or experiencing a clinically significant mental health problem at the time of the survey. If 10% of all adults have a mental health condition, then obviously this is likely also to be reflected in the workforce as well. But it's not just that mental health problems are private experiences that are impossible to really measure in terms of impact. In fact, we now know that mental health problems profoundly impact people's health in a variety of ways. Let me give you just 3 examples. The first is that it affects our lifespan by increasing the risk of mortality due to suicide, or if one is consuming alcohol very heavily due to alcohol-related medical conditions. Second, if mental health coexists with physical health problems, as it frequently does, for example, with diabetes or heart disease, it increases the worst outcomes of those physical health problems, including premature mortality. And third, and this is where it becomes particularly relevant to the workplace, mental health problems are associated with profound levels of disability. If you remember the definition of mental health that I gave a little earlier, for example, that it affects our memory, our ability to control our emotions, and so on, you can imagine that if our mental health is impaired, our ability to perform effectively at work will also be impaired. It is for this reason that there are now robust estimates that demonstrate that mental health problems are the single most important contributor from a health perspective to loss in workplace productivity. They are the single most important contributor to absenteeism, to what is sometimes called presenteeism, which means that you're at work, but you're not really performing to your full potential. And the most common contributor also to workplace accidents, which is, of course, a very important concern for those workplaces that involve factories in which things are being produced and where there's a risk of harm if there are accidents. And then, of course, there is the issue that workplace policies and practices are crucial, not only for the promotion of mental health, but also for enabling recovery. It is with this background that about a year ago, the Arogya World non-governmental organization, which is a US-based non-governmental organization, but which works extensively in India, really promoting workplace policies. Arogya World had already started working with Indian businesses to look at how business practices could help improve physical health in the workplace, particularly non-communicable diseases. And about 6 to 8 months ago, they approached Librum, which is a mental health consulting firm that I co-founded with colleagues Nehar Kripal and Shekhar Saxena, who's also a leading global mental health figure. They approached us to identify what might be the specific strategies that businesses should adopt to promote mental health and reduce the burden of mental health suffering in the workplace. And so what I'm about to present to you now is essentially a distillation of our recommendations to businesses that Arogya World released on November the 4th last year. We need to start by, first of all, embracing the idea that a workplace mental health program must be guided by some principles or values. And these are the values that we identified. Firstly, the value of parity, which simply means that mental health must be treated with the same degree of importance in every respect as physical health. Secondly, the value of equity, which means that we need to recognize that there are hierarchies that operate in the workplace and that these hierarchies affect disproportionately people at different levels of the hierarchy in terms of the risks to their mental health. To give you one example, the stressors that managers experience will be very different from the stressors that those, for example, who work in domestic responsibilities in the workplace experience. And therefore, a workplace mental health program must recognize the different kinds of work-related stressors that people will experience. The third is that of inclusion. And this is about embracing the idea of diversity of humankind. For example, let me give you just one example of a diversity, which is to do with sexual diversity. We know that humankind includes a range of different kinds of sexual orientation. Homosexuality, lesbianism, transgender, and heterosexual orientations are examples of that diversity. And any mental health program must embrace the inclusive approach to incorporate all of these different identities in the program. Confidentiality. This simply means that all information related to mental health and indeed any other health issues must be kept strictly confidential. And I think the level of confidentiality, of course, is something that the HR departments of a workplace must embrace. And it's extremely important that others outside a very select group of named individuals must never have access to information related to a person's mental health. This is particularly relevant also for substance use conditions like alcoholism, which of course are mental health conditions as well, but which can greatly influence a person's confidentiality when it comes to continuing in the workplace, a relationship they have with their managers, etc. The next is dignity. We must respect every individual equally, regardless of whether or not they have a mental health condition. Then we have quality assurance. And this means that any mental health program that the workplace is implementing must be constantly evaluated to make sure that it is achieving its objectives and that it is being delivered with a minimum standard of quality. And of course, those of you in business will recognize that quality assurance is something that is part and parcel of every workplace policy. Imagine the same ideas of quality assurance being extended to a workplace mental health program. And finally, it must be based on evidence. And by this, I mean that we must only implement interventions that are backed by science, that are backed by proof that these interventions will make a difference in terms of the ultimate goal of reducing the suffering associated with poor mental health. Using these values, what Shekhar Saxena and I did is we spent about 6 months supported by a research assistant, Sonali Kumar, and looked at the evidence that existed both in terms of scientific evidence, but also in terms of the best practices that businesses had incorporated globally and in India, and then distilled what we thought were the most important, the most acceptable, the most feasible, and the most likely in terms of effectiveness strategies for promoting mental health and reducing the burden of mental health suffering. In closing, what we want to see happen in the workplace is reframing of mental health as a public good, not just as a biomedical issue, not just as an issue about separating those in our workplace who have mental health difficulties and triaging them to a medical facility, but actually making mental health important to each and every person in the workplace, from the CEO to the shop floor worker. This means embracing the idea that mental health is a universal human quality that is indivisible from all our other health concerns and is important to all people. And I haven't said much about this, but it is important right now to say it is particularly important to young people, young adults, who are, of course, the real foundation of every workplace, because this is the age group in which mental health problems are most likely to emerge. And there are a variety of developmental and psychosocial reasons that is the case. Indeed, suicide is the leading cause of death in young Indians today, and that is a reflection of the higher risk that young adults have for the emergence of mental health problems. And of course, as we continue to live through the pandemic times, mental health has never been more important than today because of the enormous impact that the pandemic, through the uncertainties that the pandemic has created in terms of work as well as one's personal lives. Mental health has never been as important as right now. Thank you very much, and all the very best as you move forward in this year, with hope that we will finally get on top of this pandemic, that our lives will finally return to the kind of normal that we used to believe in and were familiar with, and that we will use this opportunity to build a better world for ourselves and for the people we work with.
With that, we come to a close of day 1 of BT Mind Rush. We will again, of course, see you tomorrow as we head to the finale with India's Best CEO Awards. Once again, we'd like to thank our sponsors, presenting sponsor SRM University, conglomerate partner Darwin Platform, and healthcare partner ThyroCare.
ThyroCare, the trust, the truth.